عادي خليك كلمة من هنا. Hello, doctor.
Yeah, I can hear you. Hi.
Really good.
So we're waiting for another 5 minutes, then we can start.
Yeah, we're waiting for another 5 minutes, please.
Okay, no problem. Yeah, I can hear you.
Yeah, that's fine. Good. Thank you.
So we're waiting for another 5 minutes, then we can start.
Yeah, we're waiting for another 5 minutes, please.
Okay, no problem. Yeah, I can hear you.
Yeah, that's fine. Good. Thank you.
So we're waiting for another 5 minutes, then we can start.
Yeah, we're waiting for another 5 minutes, please.
Okay, no problem. Yeah, I can hear you.
Yeah, that's fine. Good. Thank you.
So we're waiting for.
هيا نذاكر صح؟ نقدر نسكرها. هذا هي جرام هنا.
عندك اللينك هنا بعد؟
لا بعدين اخذ اللينك.
بس تفهمي؟
خليك هنا الحين شلون اقراهم من هنا؟ لا اقراهم من هنا يعني صح؟ دراسة I think we are ready to start right now. وين الورد؟ So good evening, ladies and gentlemen. we welcome all of us, Dr. Women. He's very distinct, unique speaker, and I'm very grateful for him to accept my invitation to have such a wonderful and hot topic about teeth whitening. Dr. Wyman, over the last 20 years, has worked with all major home and power whitening systems. His PhD research led to 7 UK and US patents with several more pending. Though his research and experience of treating thousands of patients, Dr. Wyman has discovered some important phenomena in the texture of the teeth, and he kindly established some important protocols and metrics that have contributed to the understanding and improvement in safety and efficiency of teeth whitening process. He has published some important paper and hypotheses in teeth whitening process. He presented so many clinical papers in the new home whitening system to measure the shade of the teeth in 3 areas: the cervical, body, and the incisal area. Mr. Wyman is well credited as he is the inventor of painless teeth whitening techniques and products including perfect trays and the award-winning Get to Smile. He has full CV full of a lot of success and achievement. Before I introduce you to Dr. Wyman, we welcome all of us, Dr. Wyman, with us this evening. And before we do so, please feel free to put your email and contact number just in case you have any inquiry. So welcome, Dr. Wyman.
Well, thank you. Thank you for inviting me, Dr. Ali. Okay, I'm going to turn my video off. I'm going to start with the seminar. Okay, so introduction to teeth whitening. Well, teeth whitening, very special subject. Just hang on, it's not working. Just wait, I could not get my PowerPoint working. Oh yeah, it's working now, okay. So I'm the clinical associate professor and senior clinical lecturer at the College of Medicine and Dentistry, which is based in Birmingham and in the United Kingdom. I teach MSc students on teeth whitening, and there's an MSc course on the cosmetic dentistry and restorative cosmetic dentistry. It's a 3-year course, MSc course. So if you'd like to learn more about teeth whitening, please look into the college. I'm the founder of Dr. Wyman Chan London, a very special clinic. It's a clinic of dental facial aesthetic clinics. I do teeth whitening, I do facial aesthetics, I do injectables like Botox, and I do a very simple clear aligners as well. Not very, very simple ones. Complicated ones, we have a PhD orthodontist doing that for us in the clinic. So you can see that I'm doing some Botox injection here, I'm doing teeth whitening here, and doing teeth whitening here. I'm a dentist like you all, but I only do teeth whitening. I do not do any other form of dentistry. I hang up my drills 18 years ago, so I just focus myself mainly on teeth whitening. I do about 90% of teeth whitening in my clinic, and the other 10% is Botox and a little bit of clear aligners. But mainly my job is teeth whitening. And I'm really glad I took that decision 18 years ago, because this is a non-aerosol generating procedure. So we don't have to wear all those amazing PPE that all my colleagues are doing now. So we just need to wear some simple, as we did before, and we can do teeth whitening and the rest of the treatment that I've been doing. I got a PhD in teeth whitening. I think this is very special. I just like all of you, I encountered a lot of problems and difficulties when I started doing teeth whitening about 27 years ago. A lot of problems. So I decided that I want to understand more about teeth whitening. So I decided to study efficacy and safety of teeth whitening processes a lot of chemistry and some clinical dentistry. So I went to the Institute of Material Research and Innovations at the University of Bolton in England, UK. I'm a holder of 14 patents, UK, EU, US, and China patents on teeth whitening technology, and we have a lot more now pending applications. So I'll just do some disclosures. I'm a founder of Perfect Trace, which we do trays for a lot of dentists. This is my special design tray, so I'll talk about later. I'm a founder of Whitening International, which we sell teeth whitening products to dentists worldwide. And in my clinic, I use my own inventions. And usually I mix my own products, all my whitening gel, I mix them just before I use them, so they're freshly made. And these are some of my inventions. These are the thermal diffusers, got 3 patents on it and very special. It's just like a heater. Just heat up the gel on the teeth surfaces to enhance the diffusion of the gel inside the teeth structure. And these are the very special trays that I designed. We have 2 patents on this. And then this is the gel that one of my inventions as well, very special gel. And these are the retractor, which is totally autoclavable at 135 degrees C, and it's very soft. I use it for teeth whitening, but a lot of my colleagues use it for lots of anterior restorative work. They found it's very handy. So these are some of my inventions that I show you. I done a lot of teeth whitening treatment in my career. I've done over 16,000 teeth whitening procedures, and I trained over 5,000 dentists worldwide since 2003, 17 years ago. I started training. So what is teeth whitening? Teeth whitening represents a bleaching process that removes stains in the enamel and dentine of the teeth. So what is teeth whitening? Teeth whitening, in fact, is an elective aesthetic cosmetic treatment. Nobody needs white teeth, but they want white teeth. We want white teeth. For example, here, let me show you some pictures. So what constitutes a beautiful smile? Like in this picture here in Southeast Asia, the women there, they consider very dark teeth as beautiful smile. And this woman in Southeast Asia, I came from Malaysia, so I actually seen this with my own eyes. They actually chew betel nuts. They do it every day, and I think their teeth get so dark, and they think it's beautiful. Yeah, but back in UK, London, we think differently. So we think white teeth is beautiful smile. But back in the Southeast Asia, where I come from in Malaysia, some tribes, they think that this is beautiful. So it's just very cultural, depends what culture you come from. But nowadays we are all westernized, so I don't think people in Southeast Asia would like to have smile like that anymore. The young girls, I think they would like to have smile like that now. So what are teeth whitening? So the methods of professional teeth whitening, we have in-office bleaching, we have home bleaching or home whitening, we have a combination of the in-office bleaching and home whitening, and then with a combination of the home whitening first and then doing bleaching. So there are so many ways of doing teeth or whitening. So you just find a way that suits you, but at the like tomorrow, not tomorrow, next Saturday on the part 2, I will share with you the method that I'm using, that I prefer. I think whatever works in your hand. So for example, you're doing a lot of teeth whitening yourself. If that works for you, keep using it. Maybe after these 2 webinars, you can pick up some good tips from me. Maybe that will improve what you have been doing. So if you're really doing really well doing what you're doing, you don't have to change. In-office bleaching. What is in-office bleaching? This is a bleaching process that carried out in the dental clinic with or without the isolation dam, or they call it the gum protection dam. So it depends on the products that you use. Outside EU, internationally, we are using up to 60% hydrogen peroxide for the in-office bleaching products. But if you are from the EU or from UK, I'm from UK, I'm a dentist in London, we only allowed to use up to 6% hydrogen peroxide. So if you're using 6%, a lot of the dentists do not bother to use the isolation dam because the concentration is too low, so low, they think that they may not cause any damage to the soft tissues. So it depends where you are. If you're outside EU, you can use up to 40%. And there are different systems in the market. Some people use bleaching lights, and some systems do not use bleaching lights. So the bleaching lights come, or the device come in many shapes and form. The first one here is made by Bright Smile in 1999. And then after that, a lot of people just copy it because it's working so well. I think that Bright Smile changed my career, changed my life. It's the inventor of the bleaching lights in 1999. They invented this, so it's the first time we dentists can actually do some dentistry or clinical work without actually putting our hands into the patient's mouth. So the first time we can make money without putting fingers into the patient's mouth. Isn't that wonderful? So this is initially is 3 times 20 minutes cycle. So the treatment would take over an hour and a half to 2 hours. So a lot of people make a lot of money in the beginning, and then because it's done so well, and a lot of companies just copy Bright Smile. Professional home whitening. What is professional home whitening? It's a use of customized trays with the peroxide gel. You can use carbamide peroxide. You can use hydrogen peroxide, depending on what works for you and what works in your hands. So now we look at the etiology of teeth discoloration. What causes teeth discoloration? There are 3 main causes: extrinsic discoloration, internalization discoloration, and intrinsic discoloration. Now, what are they? The extrinsic discoloration, like the stain here and the stain here, and this type of stain can be caused by taking beverages like coffee, tea, even the Coke, the dark colored drinks, food, tobacco, smoking, some mouth rinses like Costedel, and some Costedel toothpaste also can give rise to discolored teeth. And also, if the patient do not brush the teeth properly, you've got this bacterial plaque, dental plaque on the teeth surfaces, and this is from microtic organism, also can give rise to this kind of discoloration. At this moment in time, the extrinsic discoloration is only resides in the pedicle layer, so it's quite easily be removed. Now we have the internalization discoloration. What is internalization discoloration? So this is an internal staining of the teeth from external sources. For example, if you have all those external discoloration and not removed properly without good oral hygiene, good brushing, then they get inside the teeth system. Like if you've got a crack line, you can get inside the crack line because they are rougher, so they pick up stain easily. And also this is caused by a bacterial plaque caused by a microorganism, and can give you discoloration as well from poor oral hygiene. Now we come to intrinsic discoloration. This is normally caused by incorporation of comedogenic material during enamel and dentin formation. That means during aminogenesis and odontogenesis. Also, this discoloration also can be caused due to trauma to the dental pulp. So this type of stain is usually of systemic or pulpal in nature, and this type of stains are usually well embedded within the teeth structure, both in enamel and in dentin. So we'll look at this. This is intrinsic discoloration. This is when we look at somebody's teeth. This person got very yellow teeth. The central incisors already A4, and the canine is about 5M2, 5M3. So it's very dark. So when we look at somebody's teeth like that, where do the color come from? Is it from enamel? Is it from dentin? So let's look at this diagram. Then we can explain. I can explain better. Normally, in a normal, typically the enamel here at the top layer is see-through, is translucent. And then the second layer of dentin, which is yellower. If you do a dentistry, you know that when you do a filling, when you get into the dentin, you know the color getting darker. So it's the yellow dentin here. So normally the enamel is translucent. So when we look at that tooth here, we look at the color of the dentin reflect through a translucent layer of enamel. So that means the color from here, dark color, and reflecting through here. So as we get older, why the teeth get darker? As we get older, the enamel get thinner from the food and drinks, usually acidic, that we take. And then enamel get thinner. If something translucent get thinner, then it will get even more translucent. And then in secondary, we have the secondary dentin forming as we get older. The secondary dentin is darker, so we have a darker dentin showing through a more translucent enamel. So naturally, our teeth will get darker as we get older. There's nothing we can do about it. So in most cases, when people have a teeth discoloration, you usually have the three types of stain I mentioned about. They have the extrinsic stain, they also have internalization stain, and they also have intrinsic stain. Unless they have amazing 100% that they brush their teeth so well. But in most people, they have these three types of stains on the teeth surfaces or on the teeth structure. So look at the indications of teeth whitening. This is when people want to have yellow teeth. They want their teeth to go whiter, discolored teeth. And here, some people that they have the teeth are quite white already B1, but they want the teeth to go whiter. This is where I find in my clinic in London that people coming in with the teeth are whiter than B1 and they want to go whiter. So this is a trend. And also, I think before the placements of anterior composite, for example, look at these two teeth here, the shape is not that good, it's been cheap, and also something that is not formed properly. If you want to do some composite veneers or composite fillings or built up, I think before we do that, it's a good idea to ask the patient whether you want the rest of the teeth to go whiter, so that we can put a whiter fillings on them, or even do veneers on them, so we can put a whiter porcelain on these two teeth, or even these three teeth, if you want to make them look better, to control these two teeth here, including maybe the third one here. So I think it is a good idea to ask the patient first, so that you can make the teeth whiter and make the veneers whiter, or the composite contouring or the bonding whiter as well. And also with cases like that as well, before you replace the crown, also a good idea to ask the patient whether the teeth want to go whiter, or they want to have the same color, or the crowns want to go darker. So ask them what to choose the color, do a treatment plan about what color they want, they like to have. Contraindications, we also look at, for example, in this case, you got a long span of porcelain bridge here, which is a five unit bridge, and it's already slightly darker than the rest of the teeth. If you whiten the rest of the teeth, the contrast will be worse. So in this case, if the patient doesn't want to replace the bridge here, so I will not see the patient, because I think the smile will not be as good, will be worse off. Or if you have a severe gingival inflammation, I think we should treat the disease first here. Let's get the gum conditions sorted out before we do any teeth whitening treatment. Expecting mother, nursing mother, this is all on the small print on the boxes of the teeth whitening gel, and usually most of them say that you cannot use it on expecting mother or nursing mother. So what is the active ingredients of teeth whitening? They are hydrogen peroxide, or carbamide peroxide, H2O2 or CH6N2O2, which are reactive oxidants. So what is teeth whitening? Why people want white teeth? A lot of dentists think that teeth whitening is very similar, very simple. They look at the big teeth like that, maybe they think it's very simple, but is it really that simple? So a lot of dentists, a lot of places I go to, my colleagues say that, oh, home whitening is simple, just do some trays, give them some gel, and the teeth will go white. Of course, they will go white, but how white they will go is another matter. And whether they have any problems is another matter. To do in office, it's very simple. Just use isolation dam, gum protection dam, and just use hydrogen peroxide gel. And that's it. This is most of the dentists told me. This is very simple and very similar. But now look at the problems associated with teeth whitening. Number one, I think the first problem we encounter is inconsistent and unpredictable results. Yes, many cases, in most cases, we have very good results. In some cases, the result is not that good. But before we started the treatment, we cannot tell our patients what kind of result we're going to get. So that is a problem. That being a dentist, being a professional, that we'd like to take control. We'd like to tell the patient, I'm going to make you to B1. I'm going to make a teeth to A1. I even make a teeth to OM3. So it would be nice to say something like that. But unfortunately, at the moment, with the knowledge we have in our outside in the market, we cannot say something like that. Also, even though you have very good results, especially when you're doing in-office bleaching, but they don't last long. That's the problem. Sometimes last for a day, sometimes a week, the most maybe a month or two. So people pay you a lot of money, lasting from 1 day to 2 months. I don't think that is good enough. We need something that to last longer. We will cover this next Saturday when we do step-by-step teeth whitening. And the third question is sensitivity of pain. That's why a lot of systems out there, lots of manufacturers, they actually ask dentists, ask us to use analgesics, like here, ibuprofen, or use some desensitizing agent like potassium nitrates, pain on the teeth first to treat the teeth before we do the teeth whitening treatment. I never use any of this. I mean, many years ago, I did use a painkiller. When I use a system, they ask the dentist to use them. But as you get more experience, you don't need to use them when you really know what is going on, how to do teeth whitening. Like, I don't need to use this anymore now. I think if the dentist, you feel that you're comfortable, you don't feel like confident not to give them painkillers or analgesics or give them any desensitizing paste or to use, totally up to you. I think you just have to feel comfortable. As long as this type of stuff, they do not do any harm to the body, so it's no problem at all. So if it makes you feel better, make you feel happier, please use them. And this is what I come across a lot as well. A lot of dentists come back to me. Actually, this is from a dentist, ask me whether I can resolve all those shininess been lost after the orthodontic treatment. So, and also when you use some gel as well, when they use some gel, the different products, they also can cause the loss of shininess on the teeth surface as well. Damage to the gingival and oral soft tissues. This is a big problem. For example, here, this is published by the Australian Dental Practice in August 2008. And this is what is that? The white area on the gingival and on the gingival here are caused by the irritant effect of the radicals from the bleaching gel that have leaked onto the tissues during the procedure. So I'm sure if you do a lot of in-office bleaching, you're using very high concentration. This is very common. On the top jaw, bottom jaw, very common. So this can be avoided. So we will go through this next Saturday, how to avoid irritation to the gingival tissues. And this is the bigger problems. If you do not protect the soft tissues well, this is using a 35% hydrogen peroxide, very strong, very toxic substance. And if you get leaked to the gums here, look at that. This is 20 minutes after in-office bleaching. And this is 7 days later. How are you going to repair that? How are you going to pay for that? So this is really important. Yes, we want to make money, want to make patient happy, having white teeth, but you've got to look at the risk as well. This is something we want to avoid. We don't want to cause gingival damage, not with gingival, just, I mean, the soft tissue is damaged quite a lot as well. Okay, now the next one here, also using 35% hydrogen peroxide. You can see the lips is swollen. This is immediately after during the in-office bleaching. This is 24 hours later. Looks like this patient has some fillers done, but it's not, because it's not, because the isolation wasn't done properly. You can see that. That is the ulceration that is caused the swelling of the lips. This is a chemical burn on the inside of the lips if the protection is not done properly. So this all happened. So we can avoid all this accident been happening. So these are all accidents, but it can be prevented. And for various problems that we had, and then the patient come back and complained. When he complained, if the problem is not too big, we give him back the money, and that will be sorted out and done. But if you cause so much damage to the soft tissues, irreparable, then giving back the money is not enough. They may have to sue you. The lawyer may write you a letter. Yeah, and you may have end up paying up a lot of money. and also a lot of headaches to yourself and to the team as well. So what are the aims and objectives of doing teeth whitening? I think it's very simple. How to make teeth whitening low sensitivity to pain-free. Initially, you cannot do it pain-free. You need a lot of experience to do pain-free. But start with getting a good technique and good system, good products. You can start with low sensitivity. And you can do non-invasive straight away. It depends on the products that you use. This can be achievable and long-lasting results. So how do we do that? How do we do low sensitivity to pain-free, non-invasive, and a long-lasting result? All sound really great. This is what we want to do in teeth whitening. So that's why we need to understand the science and principle of teeth whitening first. We need to know actually exactly how it works. So let's look at the chemistry. If you use carbamide peroxide, if you're using in home whitening, a lot of people using carbamide peroxide. It breaks down into urea and hydrogen peroxide. It's not water, and hydrogen peroxide. And hydrogen peroxide breaks down into water and oxygen. So if it is that also hydrogen breaks down in other chemicals when the pH is altered as well. So at pH 10, the hydrogen peroxide breaks down to hydroxy anion, which is HO2 with a negative charge there. This is a very powerful oxidant and can remove the stain within the teeth and the dentine within the teeth really rapidly. And also, if hydrogen peroxide can react with other chemical as well, for example, we can have some catalysts. We can have some activator as well. We can use ultraviolet, and you can use raised temperature and convert into some really reactive oxidants such as the hydroxy radical here, radical OH with a dot, and also oxygen radical, the O2 with a dot here. And these are very, very powerful oxidants, and they can remove the teeth stain really, really well. Let's summarize about the chemistry. So we're going to convert the hydrogen peroxide, the carbamide peroxide into hydrogen peroxide, and it will convert the hydrogen peroxide into free radicals, like the oxygen radicals and the hydroxy radicals here. And these are the teeth stain within a teeth system. They are really, really large molecules if you view under electron microscopy. And then the way to the aim is to break these big molecules down into smaller ones, and then they will look much whiter and sometimes it's colorless. So by doing so, in fact, we are just altering the refractive index of these big molecules. You break them down, and then they appear a lot whiter and colorless. So if you don't break them down big enough, the colors is still there. That's why it takes time to do teeth whitening. Break them really down into much smaller molecules. Okay, now look at bit deeper into the science. How does the teeth whitening process work? Now we have a specimen of a dentine. It's 5,000 times magnification, and then you can see the round bit here, which is dentinal tubules. We look at the whole thing here. These are the minerals. These minerals, you can see they are quite porous. You can see the pores in them. So enamel and dentine are porous and semi-permeable, like a sponge. And the peroxide gel diffuses freely through them. If we put any hydrogen peroxide gel or carbamide peroxide gel over here, and they will diffuse that three-dimensionally into the teeth structure. So teeth whitening all about diffusion. So what is diffusion? Diffusion is a physical movement of matters and particles from higher chemical thermal potentials to the lower ones. So I'm explaining what this is really important. It's all about diffusion. Movement through concentration and temperature gradients. So look at this. This is, for example, this is the teeth surface, and it will put the gel on the enamel surfaces here, and give it time if it diffuse inside the teeth structure here. Let me just take off the here, so I cannot find. So give it time if it diffuse inside the teeth structure here. So the higher the higher the chemical, the concentration you have, the more molecules will diffuse in given a given time. But how do we get the gel to go in, the molecules go in faster. So to go in faster, we can heat up the molecules here by applying heat. So we are applying heat there, that means the molecule will move faster and go inside the teeth structure faster. That means we can reduce the treatment time. For example, for home whitening, we have plenty of time. But for chairside, for in-office bleaching, we don't have time. So that's why some systems make use of the temperature and can reduce the bleaching time, the contact time, so that the gel will go in faster inside the enamel structure. So look at a very interesting study done by Bowes and Uveneri back in 1987. This is a lab study, not in vivo, in vitro study. And they're using extracted teeth, the first premolars. That's when they take the teeth out for orthodontic treatment. They save the teeth and put it into saline. And then when it's time for experiment, to take it out. In this case, the first experiment, they take out the teeth and clean them, and then take out and extract the pulp tissues, and then to put a sensor inside the pulp tissues, and using 10% hydrogen peroxide, and then that's 37 degrees C temperature, which is the mouth temperature. And they found that after 15 minutes, there are 9.3 micrograms of hydrogen peroxide actually diffused inside the pulp chambers. So this is quite a small amount, but still there's some diffusion. And then they increased the temperature on the second experiment by 13 degrees C, which is 50 degrees. This is not the pulpal temperature, which is the temperature on the teeth surface. It will not increase any temperature in the pulp at all, because we have a layer of dentine and then we have a layer of enamel above that. They found that the diffusion rate is nearly three times higher, as 25.5 micrograms of hydrogen peroxide diffused in 15 minutes. And then the third experiment, very interesting. They used 30% hydrogen peroxide, but reduce the temperature back to the mouth temperature, 37 degrees C. They found that the diffusion rate is very similar to the 10%, but at a higher temperature. So that this experiment showed that we can use a lower temperature, we can use a higher temperature with a lower concentration to achieve the same bleaching result of a higher concentration, but above the temperature. Because at the hydrogen peroxide below 12%, it is very safe. You can paint it on the GNV, you will not feel anything. But above 15%, if you paint it on the gums, it will burn the gums and can be very painful. So the lower the concentration, the safer it is. So what that means, this experiment show that we can use the 10% hydrogen peroxide to produce the same result of the 30% hydrogen peroxide, just by applying heat to the gel. So let's summarize the whole thing. Teeth whitening is all about how the hydrogen peroxide diffuses inside the enamel and dentine, and by removing their stains. Okay, look at factors affecting the rates of diffusion is very important. We have the contact time, we have the concentration, we have the temperature. So we can play with these three non-factors that we have. For example, in home whitening, we got a lot of contact time. That means we can reduce the concentration. We do not need any temperature. That means we do not need any heat devices. But in chairside, in office whitening, we don't have time. If the time is short, that means that's why so many companies are using very high concentration to compensate for the time, that a very short time that we use for in office. And in some system, they actually use apply temperature to heat the gel up, so that to enhance the diffusion rate. So these are the three non-factors that we can use. Okay, let's show you a slide on the thermal diffusers that we use. Okay, so it's really important that if you want to enhance diffusion rates in office bleaching, if you apply temperature, you actually can reduce the contact time, the bleaching time, save you a lot of time as well. Now let's look at the importance of understanding the textures of enamel. Look at the properties of enamel. So this polystyrene film here is transparent. When something is transparent, that means 100% of the lights can get through this film and also can reflect back the film here. So we can see 100% of the pen underneath here. And when this plastic board is translucent, when something is translucent, it allows partial lights going through the board here and also allows the light to reflect back. So we can see the shadow of the pen underneath here. And this board is opaque. Some material is opaque. When a material is opaque, there means no lights can go through in and out, reflect back here. So that anything underneath this opaque board, you cannot see it at all, like this pen, totally invisible. You can't see it at all, not visible. So enamel can behave exactly the same. Enamel can be very transparent, translucent, and less translucent can be more opaque. For example, in this case here, if the enamel is very, very see-through, that means when we look at the tooth here, we can see the dentine going through a translucent enamel. In this case, we have to remove the stain in the dentine before we can change the color of the tooth. But in some cases, if enamel is less translucent, more opaque, when we look at the tooth here, and then we do not see the color of the dentine, we only see the color of the enamel here. This kind of case, we only have to remove a fraction here, maybe just 100 microns of enamel or the stain or enamel, and the teeth will go white. So for very, very see-through teeth, very, very translucent teeth, we need to remove the dentine color to make a dentine white, so that the white dentine will reflect through a translucent enamel to give us the white color. So this is really important that we need to understand where we are. So let's summarize. Most teeth are very translucent. 80 to 90% of the teeth are very translucent. That means when we look at the tooth, we're actually looking at the color of the dentine reflecting through the enamel, translucent enamel. And only very small percentage of the teeth that are less translucent and more opaque. This is only 10 to 20%. So these kind of teeth are very easily to whiten, because you only have to whiten a very thin layer of enamel. But this one, you got to whiten the whole side, the whole area of the dentine here to change the color. So much more difficult. Okay, so how to recognize see-through teeth or very translucent teeth? So take a picture. For example, here we can see the dentine all the way here. We can see the dentine here, the dentine color. You can see the translucent enamel here. So by taking photographs, you blow it up, then you can see very clearly. Same as well. You can see the dentine here, the core dentine core is here, and this is the enamel. So we can see that this is very, very translucent enamel here. But on the central incisors and the laterals, they are not that see-through, so that we do not see the dentine core here. That's why the teeth up here are a lot whiter than the canines. But the canine teeth are more translucent, usually more translucent. That's why the teeth up here darker. Same as well here, the dentine core is much bigger on the right side than the left of the left canine on the same patient. So if you take a picture, you can see whether the teeth, how translucent they are. So how does in-office bleaching work? This is a teeth in a normal condition. So hydroxyapatite or enamel, which is the minerals of the tooth. Teeth are made of hydroxyapatite. Translucent when wet. Why is wet? Because in the mouth we have saliva. So all the enamel pores here are filled up with moisture. But what happens when we dry the tooth? When the tooth is dry, it becomes opaque and white. Because by drying it, this is only using 2 minutes of a hairdryer, very small traveling hairdryer, no bleaching at all. Just blow dry the teeth here, just get rid of all the moistures in the enamel, and they make the teeth so white just by altering the refractive index of the enamel. Because when we're looking at here, we're looking at the refractive index of the enamel is between the hydroxyapatite and the water, which is in enamel pores. Here, we're looking at the refractive index of the hydroxyapatite and air. And that's why I changed the, make it more opaque, so the color will appear much whiter here. Okay, let's look at what we talk about dehydration here. This is the teeth before we do anything on baseline, about A3 in color, the incisors, the canine are a lot darker. And this is only after I put the isolation in. This take only about 10 minutes. Can you see how white the teeth has gone? This is A3, the teeth already gone between, I think, A1, B1. And look at what color it's gone to. Actually, it's gone between A1 and B1, gone about 7 to 8 shades whiter. I haven't done any bleaching yet, hasn't painted any gel. This is totally just after the isolation, when the teeth are dry, and when the moisture is dissipated away from the enamel pores, and the teeth gone whiter. So this is dehydration. Dehydration of the enamel make the teeth whiter. We see this all the time. So the teeth become whiter due to the teeth dehydrated after the teeth are isolated. And then let me show you an example if you did not understand that. For example, a t-shirt here, just like the enamel, and the skin underneath here, like the dentine. And normally, the enamel is wet when it's in the mouth. When it's in the mouth, when it's wet, when something porous is wet, it's usually translucent. And that's how we can see the skin underneath the t-shirt here, the enamel. That means very, very clear. On the next slide, you can see that when it's dry, it's opaque. On the next slide, you can see that the t-shirt or the enamel is getting drier, not as wet as that. So we can see less, it's become less translucent. So the drier they are, the less translucent they are. It's really dry, they become opaque. You cannot see the layer underneath the enamel at all. So enamel behave exactly the same way. Okay, so after in-office bleaching, the teeth appear whiter from two phenomena or from two sources. The first one is from bleaching, of course, because if you're using a good bleaching system, the teeth will go whiter. But more importantly, is from dehydration. So we do not know which is greater. But usually, from experience, the dehydration whiteness is much greater than the bleaching whiteness in-office bleaching. And that's why we have rebound. So a lot of people say, why do we have a fade back? Why they did not last that long? Because usually when we did an in-office, when we do an office bleaching, and usually from A4, then the teeth will dehydrate to about A2, which is about 10 shades whiter. And then the best system in the world probably can get you about 6 shades whiter during an in-office whitening bleaching session. So and then you have the feedback of A2 to A3, because when we look at somebody's teeth after we've done an in-office bleaching, a lot of them is dehydration. And then when the moisture is going back inside the enamel pores, when the enamels become more translucent when it's wet, then we see the real color of the dentine again. Then we see the real state of the teeth, how much it's been whitened. So usually you have a feedback. I haven't seen a case without feedback yet. Okay, let's look at this is done 1991, 28 years ago. Recent still actually did a clinical study using 30% hydrogen peroxide. This is in vivo. And after 1 week, he found a 50% drop off from the immediate post-treatment color change effect in 1 week. This is very, very common. I see this most of the time. And then this is what I've seen as well. A patient of mine, then I did whitening 3 times for him in office. Let's tell you a story. An actor, and he got a film. Got a contract to do a film, and the director said that his color, the teeth of the color was too dark. They need to whiten before he can actually start filming. So he came to me with a baseline C4, which is just over 7 years ago, and they say kind of make his teeth white. I say, yeah, in most cases the teeth will go white. In some cases they won't. I hope you are the lucky people, and a lucky group that the teeth will go white, and it did go white, really white, and I was really happy. And asked him to do, always do a combination, asked him to do a home whitening to continue to maintain the color. But a week later, he came back, said that I was so busy, he did not expect the teeth would fade back, but it really did. What I said was right, and the teeth faded back. The color faded back a lot. So he said, I got a filming to do next this week. Can you whiten my teeth? Because the director said my teeth are too dark, cannot go on screen and cannot go on the set again, cannot do filming again. I said, no problem. I did that again. So I did it again. Obviously, he paid for the second time, and the teeth gone whiter. He said it cannot go too white, similar color, so we'll make it very similar color. But 18 days later, he came back to see me and said that this time I really wanted to do it, but I haven't got time, and the teeth has faded back and it's not white enough to continue the filming. Next week is my last day of filming, so can you make my teeth white again so I can finish to film? So I did, came back, and then I whitened the teeth again. So if he had done the whole whitening, I believe that his teeth would have been this color by now. But because he hasn't done it, so there's a fade back. I haven't seen a fade back. I haven't seen teeth do not fade back if they have good results. So from baseline, first in office, second in office, third in office. But I'm sure if he doesn't do the home whitening, this will fade back again. But I haven't seen him since. This is 7 years ago. So he must have done the home whitening properly. He got 3 sets of trays and lots of gel as well. So if he finished some more, it would have lasted a long, long time. Okay, now look at the properties of teeth whitening gel. So what are they? We look at chemistry. We have hydrogen or carbamide peroxide, and then we have a concentration, either 3 to 10% in home bleaching. In office, you can use up to 40%. That's what some manufacturers do. Delivering system, you can use a single barrel system or you can use a double barrel system. I think the next one is important, pH. The pH is really important. If you have a low pH, and that's when you make the teeth matte, that's when you're going to demineralize the enamel. So we're going to find the products that are neutral pH or even better, a high pH, and that's very safe on enamel, doesn't damage your enamel at all. So you can easily buy some pH paper and test your products before you actually use them. Viscosity, I think a gel got to be viscous enough and not too runny so that it can paint under the teeth and stay there. And also not too viscous. Too viscous, it doesn't diffuse well. And stabilizer, that's what a lot of manufacturers use, a strong acid to stabilize the gel. And that's why in a single barrel, usually they're acidic because you need strong acid to stabilize it. And in some manufacturers, they're actually using a double barrel so that they can put an activator in the second barrel, and then they activate the gel whenever you want to use it. So this is very innovative. Now look at the rates of oxygen release. This is done by Chemical Research Associates in 1997. They tested 13 major brands of take-home gel, and that is what they show. After half an hour, 30 minutes, 50% of the gel has been released, the active ingredients been released. And after 1 hour, 70% of the active ingredients use up. And in 2 hours, 80 to 100% of the active ingredients is all been used up. And then they did an experiment 4 years later, this time using a lot more products were on the market. They found similar results. So whatever you use, follow your manufacturer's instruction. And whatever works for you, I always say that keep it. Just keep using what works for you. If you can learn some tips from the webinars, then that's great. And make your whitening even better. And this is a very interesting study, which I picked up in Toronto, 2008, when I attended the IADR, which is the International Association of Dental Research, which is the conference. This is by Mason and his team. And using a 35% hydrogen peroxide was assayed through a potassium permanganate titration method. So the concentration of hydrogen peroxide was measured. This is a 2 parts. They actually mixed one with the other. So immediately after mixing the gel, they measured the concentration, and then they measured the concentration 10 minutes afterwards until 60 minutes. I think what really intriguing is that the chemical analysis after 10 minutes, 32% of hydrogen peroxide left. That means only 2% is used up. And then you just suck it away, and then you apply the new gel again. What a waste. So even though they have 34%, which is 35%, is very accurate. And then after the application, only 2% is used up. So why even use 34%? Might as well use 2% or 3% and get the chemistry right, and release the whole 3% to get the same result and a lot safer. So the conclusion is that after 10 minutes, only 2% is used up. After 20 minutes, only 3% is used up. And after 15 minutes, this is an in-office gel, 35%, and only 36% is used up. So that means still so much is not used after 50 minutes. Let's look at some of the gel in the market. Like they do not work all the same. Some works better, some works not as well. So this is the one of the experiment done by Terasova using tea stain paper done in 2006 at the School of Applied Science at London South Bank University. And what they did is that they used tea for a very strong tea stain, which is English breakfast tea. 25 tea bags with 1 liter of water. You boil the water together with the tea bag in there until it's boiled, and then you use very, very thick this watercolor paper, 300 grams. You can do all this yourself. Just buy the pH paper and do some tea stain paper. So let the tea soak inside this watercolor paper, and then they can use it for test how effective all the products on the market. Then you can put it on the tea stain paper here, put different products here. The gel just apply, room temperature 22 degrees C. And then we heat it up to 35 degrees C, which is close to the mouth temperature. We found that these 2 products works better than the rest. So not all products work the same. Some works much better than the others. So you have to try and error, go and find them and do some experiment. Then you know which is the best in the market. And this is another experiment I've done. I find it very interesting because in the UK back in 2012, we were very sad that we can only use 6% hydrogen peroxide, including for in-office treatment. That's why now in UK, probably hardly see any dentist doing in office, because they say, what's the point of doing in office? You can only use 6%. That's why I went into the lab and start doing some experiment and find out, see what I can make a very nice 6% in the UK, especially for myself, instead of using the 25% gel in office gel. So I went in, and this is a gel that I made, and this is the best selling gel in the whole world. It's Zoom, made by Philips. And a lot of people say that obviously the 25% will work a lot better than the 6% here. Now let's wait and see. So we set up the experiment, and we use heat and without heat. Without the heat, you can find that the 6% works much better than the 25%. And with heat, and the 6% still works better than the 25%. The 25% works better with the heat here, because that gel is very stable. It hasn't released, it doesn't break down into the free radicals. If you heat it up, as I said, then it breaks down faster, so you get a better result. So it's amazed that 6% works better than the 25%. So who needs the 25%? And that gel we use is the best-selling gel in the whole world. So it's a 6% works a lot better within the same setting. The reason is that because we have amazing activator here, which is proven in 2006 in Brisbane. If you add the activator in there, and that enhance the bleaching effects threefold. Now look at the literature on a tooth variable. So each tooth has its maximum whiteness beyond which you will not whiten. And some will bleach faster than others. That's why some teeth will go white in 3 days, same color. And some teeth, exactly the same way you do it, to get to the same color, you may need 6 weeks. So that's why, depending on the teeth, on the texture of the teeth, everybody is different. And also, like to say, between 3 days to almost 6 weeks to get this is, we call this a noticeable result. Topical stained teeth take 1 to 3 months to see noticeable results. The tetracycline stained teeth take 1 to 12 months to see a noticeable result, but usually between 3 to 6 months you can get very, very good results. Okay, so I think been nearly 1 hour now. It's 55 minutes. So ready for, thank you for watching. And these are the emails that you can get in contact with me if you want to ask any questions about inventions that I have. Okay, I'm back to Dr. Ali, and for the question you'd like to ask.
Oh, thanks a lot. It was very interesting, useful information, and you put it in very nice, understandable way. We're gonna open the floor for questions. Please.
Yeah, Dr. Ali, if you can read the quick question, then I can answer them.
Okay. So there is a question saying, what is your opinion in bleaching primary teeth?
I do not bleach primary teeth, I think, because they will be replaced by the permanent teeth. You talk about where are they? Are they the incisors? If they're at the back of the mouth, why bleach primary teeth? I don't see any indication, but put it that way. I do not do it, but I know some dentists do them, but I don't do it.
What if there is incipient caries?
Say that again, I didn't catch your question.
If there is incipient caries, which is early stage of caries or decay.
Yeah, if the decay is within enamel, it works really well. If it gets into the dentine, it also works. But once it gets in the bulk of the dentine, obviously it doesn't work. Then the decay spread really fast. If initial caries lesion, just like a case I showed you early on with the poor oral hygiene, I got an amazing result with that. I removed all that by bleaching. You don't have to do any filling at all. So hopefully, maybe I'll put a case up next week. I didn't put it up. I'll do it next week. I'll put a case up next week.
That's really good. There is another question saying, please, what is your take on laser bleaching?
My take on laser bleaching. Laser bleaching, there are not that many around. A lot of people are using a blue light and they call it laser. In fact, it is not laser. If it's laser, usually laser, which is very pointed for removing soft tissues or hard tissues. When the laser they're talking about is not really laser, it's only a term that they use. Nobody uses laser, really laser. Maybe they have the laser, like for example, a few laser company, and they have an adapter, which is like a mouthpiece, and then they spread the blue laser light onto that. That is not laser anymore, because that is not strong, that's not powerful anymore. So in fact, I would say nobody uses laser. I mean, the term laser itself, nobody uses laser in the market, no one. It's only a term that people like to use.
Oh, okay. So, Dr. Women, if there is any instruction for home, let's say exactly the question, so any home instruction?
I think what you do is you got to follow the manufacturer's instruction. I think that is very important. If you buy something, you do not follow the instruction. If something goes wrong, you cannot go back and complain. So always follow the manufacturer's instruction. I think that is very important. If it doesn't work, you get a problem. You always can go back and complain, say, I did exactly everything you asked me to do, but you didn't, but the result wasn't there, not what you promised, then you can make a complaint. But if you try to change a protocol, that's why I know a lot of people do some products and they try to change the protocol and it doesn't work, then because you do not follow the manufacturing instruction. These manufacturers, they already done a lot of experiment. They have lots of experiences. So try to stick to the instruction, and that is my advice.
Yeah, definitely, it's the best. Okay, have you done any bleaching on patients under 18 years old?
I have done many when it was okay. When before 20 and 12, I've done loads. I did whitening for bleaching for my daughter. I got two daughters. The older one is called Tiffany. The younger is Crystal. I did bleaching for Crystal, the young one, when she was 7. And I did bleaching for Tiffany when she was 12. I actually did power bleaching on Tiffany. I did home whitening for Crystal when she was 7. I took impression, and she's still, I think, she's 18. She's 18 now, so she's going to be 19 next week. and her teeth still nice and white after 12 years. After 12 years.
That's really good.
And Tiffany's teeth, same after 12 years, still nice and white. And their teeth are still there, haven't fallen out yet.
That's really good. So how about nowadays, if you have or you come across a patient under 18, do you still go through bleaching?
If you're in UK and EU, no, because it's against the law. If you're outside UK and EU, yes, there's no restriction. Just outside the EU, there's no restriction. Then just tell the patient to go to Saudi to see you, Dr. Aetiology. Just ask them to buy a ticket, go and see you.
Yeah, this is the thing. So apart from, I'm very aware about the legislation down UK is not allowed, but apart from the legislation in UK and Europe, if there is any contraindication for bleaching when it's come to children below 18 years old?
Absolutely no. To me, that is a silly law, and it's a silly law, and it is silly.
Okay.
That's all I can say. Because why the rest of the world can do it, and only EU, only about 400 million people cannot do it, whereas 7.5 billion people in the world can do it. So it's not right to me.
Fair enough. Okay, what is if there is a composite restoration? Is it still going to be contraindicated with composite?
You mean, does it work on composite fillings, the bleaching?
Yeah, I assume so.
They do not work on artificial materials, only work on teeth. Doesn't work on enamel, doesn't work on dentures, do not work on composite fillings.
Okay, but you must come across patient who has composite filling, and on the other hand, they need a bleaching. How do you deal with it?
This will be covered next week.
Brilliant. So we have a lot of interesting things.
Yeah, this is step by step teeth whitening. We will cover a lot of cases. Hopefully we can cover within an hour and a quarter, hopefully. A lot of cases next week.
Looking forward. Okay, which is bleaching agent is indicated for a young permanent interior which has discolored post-trauma?
I think you got to try and error. I never recommend any products in a webinar because this is a scientific base. So it's just for you to try it out, try and error, buy some pH paper indicator, and buy some English breakfast tea, and buy some papers and make some tea stain paper, and like me, test the products out. Then you know which is the best. Because for me to tell you which is the best is not right, because it may work for me in my hands, it may not work in your hands. So best, I think, always advise my colleague to try out yourself. Don't listen to anyone. Try out yourself.
Thanks a lot. Dr. Wyman, how much the duration or how long the duration of bleaching for fluorosis? And
we'll be covered next week.
Okay, and the continuation of the question is the same for tetracycline stain.
Yeah, so same cover next week. Cover next week. I have cases. I will have cases of fluorosis. I have cases of tetracycline. I have a case of fluorosis, a case of tetracycline to show you next week. I
can't wait for next week, Mr. Wyman.
Good.
Okay. Does the bleach affect glass ionomer restoration? And if we have patient with a lot of anterior proximal caries, what is your protocol?
I think that will be covered next week as well. So wait till next week.
Okay. So where do you draw the line between bleaching or restoration for patient with extensive tetracycline staining and dental fluorosis, and how many sessions for an office bleaching?
Very, very good question. Amazing question, all this. And I'm happy to tell you that all this will be reviewed next week.
Okay, so we have another questions coming from Russia. She's saying, in a pregnancy, it is allowed or not?
Say that again.
during a pregnancy, can we do
Yeah.
teeth bleaching or not?
My advice is no, because it's not the products. I don't believe the products will do any harm to the fetus. I do not believe in that. I think, to me, hydrogen peroxide is so safe. It's one of the safest chemical really that we use. Very, very safe. And the reason I do not do even for my patient when they are pregnant, because it's very funny when they're pregnant and then when the baby is born, is anything wrong with that baby? They would start thinking, what did I do in the last 9 months during pregnancy? What did I do? And then, oh, I remember I went to see Dr. El Ali and had some teeth whitening done. And you'll be in trouble because you cannot prove it's not from you. There's a whole reason I do not do it.
Yeah,
Because
that's right.
something you cannot prove.
Yeah, I think they should have a peace of mind during pregnancy, apart from emergency treatment, and all of like unnecessary treatment should be postponed after the delivery.
I will postpone until the delivery. Nursing mother is fine with me. I have no problem. I know that it's very safe. So when the baby is born, then it's okay. When the baby is not born, anything happens, that's the danger. Because when the baby is born, I know that will not do any damage to the baby, so I'm not worried about that. So only when it's not born, that is a problem. Because the mother or the parents, the whole family will start writing down, what did I do in the last 9 months that I should not be doing? They always ask that question. So it's the danger, or it's unknown. So my advice, don't do it.
Yeah, that's right. So most of the practical or something to do with the clinical or the practice of bleaching, we're gonna deal with it next week.
Yeah, we have step by step. We have step by step home whitening. We have step by step in office, and then we have a lot. Then next week we actually show you step by step how the way I do it. In fact, I'm going to show you the way I do it in my clinic next week. Very exciting.
That's really very exciting. It's going to be a very rich session next week. Okay, we have one more question. So Dr. Wyman, how do you prepare the patient to accept short result, or is there any way to prolong the result of a bleaching?
I do not accept short results myself, so my result is all long lasting, and at times I even guarantee them forever. So they will be all review next week.
I think Amy Habib taking us back to one of the questions which been asked previously about bleaching in children, and saying carbamide peroxide or hydrogen peroxide for children, which one is safe?
Both of them are safe. Both are safe. They're the same chemical. Both are safe. Very similar chemical. You can use both. You can use both.
Thank you. You know, when you mention about the longevity of bleaching, and it varies. Sometimes it's lasts longer than the others.
Yes.
Can you predict that beforehand?
I can. That's why you need a lot of experience. You need a lot of, I would say, knowledge. Knowledge plus experience plus good technique. I think like anything else in the world, for example, you look at a good tennis player, they do not born and play tennis like that. Yeah, they may be talented, but they really practice very hard to get to where they are. Like the top 10 in the world, they're the professionals. They practice and practice and practice and practice. That's like teeth whitening. That's like we're doing dentistry. We've got to practice and practice and practice. I think to be good at something, you have to do a lot to be good at something.
Yeah, definitely. I agree with you. And you are at the top of the pyramid when it's come talking about teeth whitening, because you've done a lot.
Thank you. Thank you. I've done a lot. I've done over 16,000 cases, a lot.
Yeah, and this is scientifically based as well, which is strengthening the
It
user.
is, because
Yeah.
all my cases I documented them. That's why in my mind, I'm the AI of the teeth whitening. So if you show me a case, I can tell you what result you can get. This is exactly, I teach in China. This is exactly what I want to teach in China now. I guarantee results in China. And I'm doing something like Invisalign in China. The dentist, I ask for certain parameters, they send it to me. And then I do the treatment planning for the dentist. And I help them to guarantee the results. Maybe something, I haven't done this in the UK yet, but it works really well in China.
That's really good. Yeah, I heard from you that you trained like a dentist just to make sure you maximize the outcome at the end.
Yeah,
Because
I really want the dentists I train to guarantee results. Otherwise, you cannot charge. If you do not guarantee results, you cannot charge for the treatment.
yeah, that's fine. So hopefully next time you're gonna train Saudi dentists then.
Hopefully, yes. Hopefully, you invite me there. I go and train you all, and then you can start guaranteeing results.
Yeah, for sure. Why not? Okay. You mentioned very interesting point, which is the difference in translucency between teeth. So some of them, they by nature, they are more translucent than the others.
Yeah, it's by nature. We are born with that.
Yeah, and some of them, they are opaque.
Yes.
So how do you overcome, or which like procedure you follow to overcome this?
I think it's just, for example, I did say that the translucent teeth needs more time. So just have more time. And the less translucent teeth take less time to get to the same whiteness.
Okay, so by allocating longer duration, you maximize the outcome, or it's gonna be better.
Yeah. There's a lot more. Like these two webinars, I'll probably cover only 5% what I normally teach, and you found it so much already. So there's a lot more to do it really well, do it properly. I think you have to practice. You learn from me and then all this, but I think to do it well is the number of cases that you're going to do. You really have to do a lot of cases. The more you do, the more experience you have, the more problems you encounter, the better you are, because then you know how to solve the problems.
Yeah, practice is part of the learning process.
Practice is so important.
Okay, Diana is saying, is the 6% gel you talked about available in the market?
Yes.
And what activator did you use in it?
I use it for everything. I'll use it for my in-office. I use it for my home. I use it for everything. I don't need to use any other gel.
And how about the activator you are using with it?
The activator, I mean.
Yeah.
That is the patent. That's a secret. That's the whole point. That's a secret. That is our patent.
Okay. I think there is so many questions coming up, but most of them, the answer for them, it's gonna be for next week. Yeah. So, you know, when it's come to chemistry, chemistry is good in a way because it gives you a better understanding of how the procedure and the mechanism of bleaching occurs. But on the other hand, for dentists, it's hard to digest and to take in.
And that's why I'm very lucky. I did chemistry. I did a PhD in chemistry, and I'm a dentist. So I'll combine the two together so that will hopefully benefit my colleagues all over the world. Chemistry is really important. You got to know how the gel works, why it doesn't work, why other gel doesn't work as well. So if you do not do experiment, do not understand chemistry, actually do not know how it works, then we just all working in the blind. So it's good. It's good that I think the chemistry combined with the clinical dentistry that I have, that hopefully I can help a lot of my colleagues in the future.
So I do understand quite a lot the importance of knowing chemistry and like maximizing the result during a practice, especially for us as a dentist. But you know, the acceptance from the dentist is not as much as you, because you are in love with chemistry.
Yes.
Apparently. So what is the minimum amount of information chemistry wise they should know just to cope with the need of the use of the material, especially with the bleaching agent?
My answer is 0. They don't need to know anything. They just need to know how to do it. That's how I teach in China now. They don't like the science as well. So they just like to know how to do it, how to get the results. I think most dentists are like practical. They like to do it and then get a result. They don't want to know the science behind that. So that I understand. But to teach the dentists, I need to show them the importance in the chemistry as well. After they learn the chemistry, they can forget about it totally. 100% they can forget it. At least they know the chemistry involved.
Yeah, but I noticed like in UK is different from like developing country. The children from young age, they attach to the science and they like it more, and they use it in the daily life. Yeah,
I think yes, science in school they taught a lot. Even from primary school, is teaching science. Yeah, I think in the UK the science subject is important.
I think we covered most of the questions, apart from the things we need to cover for next week. Do you like Mr. Whitening to add anything at the end, please?
No, I'm really happy, and I'm glad you guys really enjoy it, and I enjoy myself. So I'm looking forward to share more information and with you all next Saturday, same time.
We are all waiting and looking forward for next week. Thanks a lot for such informative and broad our understanding about the bleaching and whitening agent. Thanks a lot for accepting our invitation from Al-Amal conferences and exhibitions. And we welcome our audience and thank them for giving us the time and effort to listen to such interesting webinar. Thanks a lot for everyone. See you next week.
Thank you. I'll see you next week.
See you.